Hi, my name is Thalia MK at Health 2.0 Conference, the Winter 2022, and I have with me Mr. Ravi Ramaswamy. He is CEO of RV Consultant, and he is also awarded for outstanding leadership. Congratulations, sir. Thank you so much for your time. Tell us about your consultant.
I think basically what we do is I just about retired from Philips and into consulting in the healthcare space. So what we do is basically look at it from an end-to-end perspective in terms of providing solutions, technology forecasting, understanding what the customer needs are, looking at possible areas of diversification and business development. And once you get into product development, the question is how do you understand the needs of what the products are going to be? What does it take to develop the product, and what does it take to sort of launch it into the market, the go-to-market strategies, and then follow it up with lifecycle management. So the entire 9 yards with respect to product development is sort of supported by us because we understand what it takes to make a hyper-regulated product for the healthcare world.
Amazing. So, how does a company reach out to you, and what are the pointers they should reach out to you when they are about to start a business plan or they are writing it down that yeah we want to work for it? How when the company should reach out to the consulting part of the journey?
Tanya, it depends on what exactly the companies are looking for. As I said, RV consultants offer a complete end-to-end package. So from that perspective, different companies could be in different stages. We could possibly jump in and support what their needs are. It doesn't really matter.
So when it comes to consulting, I think so people like to avoid that because people have their own pointers in their head, and when it comes to consulting, not everybody will take your consulting in a positive way. Everybody will have their own pointers even after you consult. What a person, if I'm opening a new market, I'm going into a new field, I am opening a new venture. What pointers should I keep in mind before consulting you?
I think this is a question which most people have asked me, and my answer is simple. If you know what has to be done, you will get it in the books. If you should know what should not be done, then come to me and I will tell you what should not be done and where you are going to get into trouble. So that's where my value add is, in the sense that having worked across 70 countries in two major multinationals, both with GE and with Philips, you really have seen, I'll say, a fair bit of what happens in the healthcare world over the last 3 decades. And we know what works and what does not work. And that's where the advice and the value add that we can bring in. You don't want to put your hand into a fire to know that it is going to burn.
Exactly. I know it is. It hurts somewhat of ego of people whenever they're starting to take consulting, and if it is critical or criticism is involved, it's not easy to take in. So tell us that having coming here at Health 2.0 conference, how does that learning and networking experience has been for you?
I think Health 2.0 has been a phenomenal experience. I would possibly want to compliment Ayushi and Aarti for sort of getting me onto this panel, onto this platform. You get to see a diverse views, diverse audience from all sort of walks of healthcare coming in with their own stories and trying to contribute. There is a lot of cross-learning that we get to see, from the big ones to the startups to the pharma to the medtech world. So from that perspective, the learning has been an amazing journey for me. It's still fresh because having been in the industry for long, having been there, done this for several years, there is always still some freshness when you come to these events to look at how things happen differently in the new world.
Thank you so much for your time. Congratulations. I hope to see you around. If anybody wants to take your consulting mind, how can they reach out to you?
I am available on LinkedIn. That's possibly the best way to sort of reach out to me. My mobile number is captured there. My email ID is there. So just sort of drop a mail and then we can start a discussion.
Thank you so much for your time. And if you want to start a journey in anything, you can do it. And consulting never hurts. So keep an open mind before you head towards Dr. Ravi. Thank you so much for your time and have a great evening. This is Thalia MK signing off.